Well, good morning to everyone. झोपलेत का जागे? मी झोपू देणार नाही, don't worry. You know, I'm here and I'm going to talk something very different. Why different? The whole process of my talk will explain you what is the different means what. Just I want to tell you something. This is what I am going to share you. You know, there is something called as a stereotype. Everybody think to do a medical profession to their best. But where is the problem? And second thing, I have a very special bond with the student. You know, to maintain that bond, the student are responsible rather than me. The reason being, this is what I do. We do a 10 surgery. I do 10 surgery every day, and I have 376 surgeries today on the waiting list. And this kind of surgeon or the plastic surgeon is not existing even today in India. And this is what the work I am doing since last 25 years in Latur. Okay, but still, you people invite me, and let me tell you very honestly, almost in last 25 years of my practice in Latur, I haven't been to any this kind of talk on weekdays. You know, usually I deliver talk, as you know, and everybody you know. Yeah, I like to deliver talk. I like to talk to the students, but not on the weekdays. But this is the first time I am here on the weekdays, just because of Shruti. She's like a daughter to me, and initially she requested me, then they convinced me, and finally when I said no, she compelled me, you have to, and that is why I am here around. So in next few minutes, I am going to tell you the stereotype. See, everybody, I mean everyone, when you have a highest degree or higher the degree, you choose the tier 1 or tier 2 city to practice. In my time, I mean I'm talking about 27 to 28 years ago, means before your birth, right, I completed my MCs in plastic surgery. That time the scenario was something different. Even today, the scenario, the highest is degree, biggest is city to practice. Am I right, Doctor? Right. But you know, my mindset was slightly different, and that is what my today's talk. I choose this talk just because I am delivering this talk in Nerul, Navi Mumbai, and I want to tell you something which is very different from your mindset. So today's talk is only for changing your mindset, and that mindset, how I have changed, I am going to narrate my story. And that story is just changing the stereotype, deconstructing the stereotype of the medical profession and the scenario of the medical profession. So just be ready to hear the story. See, I completed my MCs in plastic surgery in January 2000 from JJ, and I decided to start my practice in Latur. You know, I was with Dr. Baman Davar. He was my teacher, but he is the person who loves me like a father. Even today, when I start my first surgery and take my first incision, I just remember him in my mind. I say Dr. Baman Davar sir, and then I take my first incision, even today. That much credit goes to him in my whole professional life, in my human life, and in my whole life. And this fellow asked me, Vithal, be with me. I will send to US or UK for a year, and this is a chair where I am sitting today, will be your chair tomorrow. But be with me. I don't know why, but he loves like anything to me. But finally I told him the dream. Sir, I have a very different dream. Okay, this was my dream, this was my mindset. I just want to go to Latur for two reasons. I want to stay with my parent. Everybody loves their parent, but I have a very different and very special bond with my father and mother. And they are from very small village, uneducated parents, and they didn't like Mumbai to stay for. And second reason, the plastic surgery means is a branch of rich people. This is accessible to the only elite group of the society. And I decided, what about the poor people? Because my background was from very poor family. So I want to take this as branch of the rich people to the poorest or the last person in the society who is in the most need. That was my mindset. I mentioned to my boss, my father, mother, my son and my wife. And I don't know, my wife and my mother, my father and me, uneducated parents, but the thing which even I am today here standing, just because of them, nothing else. Right? So what matters in the life? Not the money, not the career, not the awards, but matters in the life is the staying with the parent, loving them up and taking their blessing every day. That really matters in the life, and that is what my mindset, my dream. I told my boss, but somehow boss was not ready, and finally again back to Latur. He's my son. Now he's doing his MS General Surgery. He has completed his MBBS from BG Government Medical College and doing his MS in General Surgery. He's going to do MCS in Plastic Surgery as well. I got only one son, so he don't have alternatives. He has to go through that. You people have alternative, he doesn't. So, and this is my background. My elder brother, Dr. Padma Shri Dr. Vitthal Lahane. He was our ex-director and is a Padma Shri awardee. He is doing practice in Mumbai today. He has a Raghunath Netralaya in Prabhadevi. A good team, good work. He has highest cataract surgery of his name, and he was my mentor even today. He was my guide even today, and this is my background. That is why I chosen Latur. I was just telling you the stereotype and change the stereotype. How does it work in my life? That is what the story I am going to tell you. And finally, I will ask you what you have taken from this story. So these were the people in the need. They're the cleft lip and cleft palate people. These are the people. They were spending their life with this deformity, with this defect, just because they could not afford the cost of the surgery, or these kind of person, the person who will operate on them, they are not available in the rural area. Leave apart the rural area. When I passed my MCs in plastic surgery, they were only plastic surgeons in Nagpur, in Pune, that 2323, and in Mumbai, total 16 people. Okay, now Maharashtra has got 350 plastic surgeons, it's a different story, but only 16 people in the Maharashtra. Right, and these were the people just spending their life. The problem is, the female are not getting married. Even though married, there are a lot of problems in their life. Just because this deformity cannot be corrected because they are staying in the small place and affordability. Nothing else. This is a 100% treatable one. These are the people with this deformity and this defect. Where they had to go? If somebody is traveling from, suppose the Latur or the rural area or the Marathwada or any place to Mumbai. Here in Mumbai, the concept was, my boss, Dr. Bamandavar, was honorary to the Grand Medical College and JS Hospital, Mumbai. He used to sit 2 days in a week in his consulting, Wednesday and Thursday. Right. If Wednesday and Thursday we couldn't, that too, the consultation time was 1 to 3 in one place and evening 6 to 8 in the other place. Right. If person from traveling to the Latur and came to Mumbai and he missed the train or missed the bus and he missed the time, He has to wait for 8 days in Mumbai just to consult on plastic surgeon. That was the story. How anybody can come and take this kind of consultation of the treatment? That was the issue. And that has been observed by me for 3 years. When I was in JJ Hospital, I was with Dr. Baman Dawar sir. And somehow I decided from day 1 to day 3, the first decision, no, I have to go back and give this facility to the poorest and the neediest one. Right? So, and these are the deformities, post-born deformities. These are the noses. Right? These are the male or the female. There are a lot of difficulties in their marriages. Even their confidence is low. And who is going to operate? Only the rhinoplasty or the nose plastic surgery to be done by the all hero and heroines. Not by other common people. Why? Why? Because this is a very, very costly affair, the first thing. And secondly, the people who does it, they are only available in the metros. Okay. I was just asking to my boss, see, what is the difference if we operate in Mumbai or if we operate in Latur? What is the difference? The surgeon is same, hands are same, patient is same. What is the problem? What is the difference? The difference, nothing. Only thing that is a mindset is a different. Mindset is a different. Okay. So that is why I was decided, not only decided, took a decision and chosen a Latur. Many of you are from Latur, and in my time, 1993, there was earthquake. Okay, when I was an intern, and I was there in Killari and Latur for 1 month. Not only me, the whole team of mine, because I was doing my MBBS in Ambijogai Government Medical College that time, and our whole team was there for 1.5 months in Killari and the Latur area. And when I talk about the Latur to my boss asked, where is Latur, Vithal? Sir, the earthquake? Oh, I know. And you are going there? Why? So he surprised about the Latur, and Latur means, the one of the most underdeveloped area, developing area. And particularly in Latur, that time in 1999 when I took a decision, 1993 was the book. This earthquake, hardly 6-7 years after I was decided to go back to Latur, because that was my native district. And nobody was, even I entered Latur, I was the only MCH qualified person or the medical profession in the Latur. Only one. Right? There were people, but having only MS or MD degree, the first super specialist to enter Latur, that too with the degree of the plastic surgery. That too with from Grand Medical College and JJ Hospital. Having all opportunities in Mumbai, because my elder brother was here, well settled person. Everybody knew him. People are ready to put me a red carpet to walk on. And everybody, every farewell atmosphere is in Mumbai. And then I denied every aspect of it and went back to the Latur. Even today we have water scarcity. And this was the first day, 5th April 2000 was my OPD, and 21st May 2000 I started my unit in Latur. Okay. Last 21st May, I mean few days ago, I have completed 25 years of my practice in Latur. And the problem was, I had went to so many banks for the loan, because I was in the need of 3 lakhs rupees. 3,06,000, very specific, was a need of mine on the day 1 to start my practice. My brother was doing, he was a professor head ophthalmology, salaried person, having no money. He underwent the renal transplant in 1995. So we had a lot of problems in the family as well. No money. Where from father, mother couldn't afford even 1 rupee to me. And for the loan, I had been to so many banks. And nobody was ready to give me the loan, because I hadn't anything to deposit as a parallel property in the bank to get the loan. That day, till that day, poverty was the main reason to dedicate myself. Even today, I feel I am from poor family. That is why I am here. Okay, I don't think the rich people doesn't come here. They do, but my main strength was my poverty. Even my elder brothers and mine. But that day, I really become bored, because nobody was ready to give me a loan. I called up my elder brother, I cried on the phone, and then he sent his friend to me. His friend has given his land on my name, 16-acre land on my name, and that land I put it into the bank as a parallel property. I mortgaged it, Okay, and then I got the loan. This is the stories to start my practice in Latur. And then, from day one, I decided to do something, right? I mean, something for the society. Every anniversary of the hospital, every anniversary, I do some camp. So this is a cleft camp. This is a me, slight change. From intensive, I have decided not to change because my surname is Lahane. I want to be a small. Right. Now, 10th of the July, I will be 56. So, I want to maintain this 83. Why 83? Again, I will tell you the story. Till 83 of my age, I am going to operate because this is my boss is to operate till 83 of his age. So, I follow my boss. So, these are the camps I did. But doing once in a year, 10 or 15 surgeries of the cleft lip or cleft palate was not going to solve the problem. So, I asked Smile Train to help me. Smile Train is on our organization who helps for the cleft lip palate surgeries, right? And I called upon the Smile Train. They asked me, where is Latur? First question. Latur is one district in Maharashtra. How long from Mumbai? Answer is very difficult. 420 kilometers from Mumbai. Oh, then how to come? Which airlines operate in Latur? Year 9. Kai bola In 2000, there was no train. In Latur, we have started train in 2008. Right. I told them there is no train, no airline. And then why a qualified surgeon is doing there? What? Don't ask me the question, please help me out here. I am here around, just help me. I am just asking your help because I am from very poor family. I can't afford to do free surgeries. You do something and I will operate on this patient. Then one person from Smile Train called as Satish Kadara. This is a condition, we have almost 40,000 these babies birth every year in India. And the operating persons are very less, so there is a lot of backlog. Even today, almost 10 lakhs people are on the backlog. So that backlog need to serve. And see, this is how many people, you just can't imagine the number of people having the defect. And there is no more defect. And there is no more defect. This was my story, and this is something I want to do it for them. Then I started the partnership with the Smile Train, and we are started operating on this patient. And every patient is without defect. You can see this patient, and what is more important, the surgery should be the world standard surgery. Even though you do a free or you do with the charges, that doesn't matter. Okay, what matter is the quality. And these are the people, they married, they divorced, and again they remarried. I have so many stories. Okay, I mean so many stories. They married because of some different reason. First marriage, he lost his wife, and then for second marriage, they need somebody to work at home, and they marry this female with the defect, and again when they finish their use, again they throw it out. These are the very different and very real stories I've gone through. So I operated all these patients. Again, this is a to me, very satisfying things. Everyone back to their home, back to their family, and they're doing everything with their children, with the husband, with the family, and they are as normal as other people. So I had been to so many people in the world. I'm very lucky. I had been to very giant people. I mean, the big people in the world who works on these things. Honestly speaking, I'm from a very small family. I'm practicing at a very small place. I'm a very small person. I'm very simple person. But the people who are working with me now, today, I have got almost people from 95 countries in the world. They are with 95 countries in the world. They are with me. Can you imagine one person with a small family working at Latur and having 95 country people working with me? So this happens just because of the Smile Train, their support, and the cleft team and the cleft work. So I had been to New York University for some time in the training in the cleft lip and cleft palate, and I came back. But I have attended one conference in 2008, and Dr. Summerland is one of the very big person, very big name in the cleft lip, cleft palate. If you open the Dr. Summerland, you will find so many technique on his name. And I was attending on like this. I was sitting in the audience, and he delivered one talk. and one of the audience, plastician sitting in the audience, he asked a question to him. Sir, if the patient with the 12 years age, with the cleft lip and cleft palate deformity, which one will operate first, lip or palate? Simple question. Surprised. Why this much simple question is asked that big fellow? I surprised. And to my surprise, Dr. Summerland answered him, I don't know. Means what? I know, yaar, I know. Why you don't know? And then Summerland answered, why you don't know? He answered, in our country, Summerland is from England, in our country, patient come with the sonography report with the cleft lip or cleft palate baby in the utero, and then we counsel the parent. At 3 months of age, we operate for the lip, and at the 1 year or before 1 year, we operate on the cleft palate. So in our country, we don't have patient after 1 year with this deformity. So I don't know which to operate first or which to operate second. My goodness. असं म्हणतात ना की you turn your head 180 degree, but that day I turned my head into 360 degree, where I am, what I am doing, because I operated patient with the 60 years of the age, 70 years of the age, and 12 years and 10 years is common every day to me. Every day, man, to me, if the patient come with the 10 or 12 years age, I was happy. Patient are coming early because I could see the patient with the 60, 50, 40. And that day I came back with some aim. I decided to work like anything. And then I wrote letter to the every person, every medical professional person, concerned person in the Maharashtra, to the all collectors of the all district, all CEO of the all district, civil surgeon, DHO, primary health medical officers, all teams of the all medical colleges, that this kind of surgery I am doing it free. Please send this patient to Lahane Hospital, Latur. We will do it free under Smile Train project. Then I got the help from very good people. Dr. Praveen Geda is an IS officer and good friend of mine. He was junior to me in JJ. He was the CEO at Latur, and he came to me, sir, you are operating this patient? Yes. Then he wrote later to the Sarva Shiksha Abhiyan, was the one Abhiyan in Maharashtra. They collect these kind of patient. They send the patient to any government hospital. If I am doing it free, I was very happy. And then I got again one officer called like Sachendra Pratap Singh, SP Singh. He was second CEO while in this curriculum, and he helped like anything. And this patient from Amravati, Akola, Buldana, Wasim, Nandurbar, you name the district, 29 districts in the Maharashtra. Usually they send me a letter. These are kind of patient with us, and then I give them appointment for 3 days. Then the patient come to our hospital. We operate. We send back. These kind of things are happening, and these are the camps. We do it. This is a nano. I got it from Tata. They given me a present. For this project, and I myself drive this nano in Latur, not out of Latur, but I really feel pride to drive this car myself. And this is a team. We are doing the free surgeries, right? And if I put some assistant, he asks for the more money. This year, next year, please increase the money. How to increase the money? I am doing it charity. Okay, and I need a very great assistant. In plastic surgery, very fine surgery. So we need a great assistant. So I can't afford it. To start my practice, getting a loan was a difficulty to me. This was my condition. And how to give a money to the assistant to assist me? Very difficult. Then my wife, she's a dentist, and she asked me, can I assist you? The question is very difficult to answer, Dr. Sir. The reason being, to make a wife to assist. Oh. Make a husband to assist is easy. To make a wife to assist is very difficult. But I am very lucky to have honestly, very good wife, great human being, great wife, great daughter-in-law, great mother. And she, not only us, she started assisting me. She's a dentist. She started assisting me, so we have a great team, right? She is Kalpana, my wife. Oh, sorry. She is my wife. On this side, Dr. Rajesh Shah is my anesthesiologist, and me is a team. So this is a team which is not going to live apart. If I don't increase the salary to my assistant, he used to leave. Now this is a team which is not going to leave each other, right? So this is a team we formed, and this is my first hospital. The first hospital, I started in 2004. 2000 was on rented place. This is my first built hospital in 2004. This is my good team, and now working on 2004 to 2014, 10 years non-stop. Every day 2 to 3 surgery, every month cap. And to my surprise, one day, the patient with this sonography report came to me in my hospital, in my OPD, and showing, sir, this is a sonography. It says, my baby having cleft lip and cleft palate. This is the best day in my life. I cherished like anything. The reason I will tell you. And these are the patient. Every day they are coming. And now, in 2022, I had been to the Brazil for the conference, and I met Dr. Summerland. And I told him, Dr. Summerland, in my country, we have the same protocol which you follow. Even which you follow, right? In my country, patient comes to me with the sonography report. We counsel them up. We operate on the lip at the 3 month. We operate on the palate before 1 year. And even in my country, we don't have patient after 1 year. Just I want to tell you boys, just I want to tell you students, be consistent with one work, be determined with the one work, and the consistency will give you a great confidence. Okay, and just consistent. Don't do a work in a day and just finish it. Do it every day. What I'm telling you, 2 to 3 surgery per day. I do almost 12 surgery per day, but only 2 or 3 surgery free of cost, and that had built it like anything now. So these are I was telling you, I compare my result with the world standard persons who are operating in the world, not in the Maharashtra, India, Latur, Mumbai, not like this. The highest quality possible, that should be delivered to the patient. Always think this is somebody which is your blood relative. This is something really great. So these are the patient, you can enjoy the pre and post surgery. Now see the smile. Okay, just now I click these pictures. If you see the picture on the left, these are all mothers. They come to me for surgery, and usually the mother is a great lady. She usually cover the face of her child with something, and then come to me, my OPD, and then she open. Why you know? Because someone will see the face, okay, and it will not look good. Someone will blame to me or blame to my child. I don't want that. So she cover her face or his face and come to my OPD, and then with the always crying face, sir, this is my child. Please do something. And then I operate and I discharge the patient. On the day of discharge, again I ask the same question. Hey likru kunache? Hey likru kunache? And the answer is a smile. Right? That is. Now, everyone of my team asked me, sir, why do that much job? What is the need today? The need is their need, not my need. And that need should be enjoyed one. So, this smile is my strength. This mother's smile is my strength, and that strength is motivating me every day. See, these are the faces you can't imagine. The amount of strength that gives to me, the smile, there is the happiness cannot be measured in money. Impossible, right? So these are the means, if you see these patient and their parents, you will be mad for a day, right? I just remember the face and I just enjoy the day. I start in the morning at 4:44 in the morning, every day, 4:44 in the morning, and I end my day by 6:30 in the evening. Usually nearly quarter to 14 hours I work every day last 25 years today, right? So, he's my wife. See, that is what I just admired about her. I want you to show the pictures of her. So, and this is what I want to tell you. Till date, in introduction slide, I have seen the 6,000 was the figure. I don't know where from you took it, but this is today 10,500 surgeries I have completed. 10,597 surgeries I have completed today with single hand, by only one hand, right? One surgeon, right? One surgeon. This is the highest number in the Maharashtra. Can you imagine this? This record is on my name last 20 years. 20 years I am holding this record and nobody has broken it down. And I am in Latur. I am in Latur, very small town in the Maharashtra, right? And holding the record highest, even in the highest in the Mumbai as well. Highest in the Maharashtra and number 2 in the India. I am holding this record. Can you imagine this? And that too only one person I am telling about. There is no second assistant to me till date. And only we are not stopped at this. We are not stopped at this. Plastic surgery is not only doing a cleft lip or cleft palate or not doing only the cosmetic surgery, it is about the trauma. Trauma is the main reconstructive point of the surgery. And this is what we have started the unit. Need, start it, do it. And can you imagine, this is the fellow, before and after surgery, how much is the affordability of this pillow? I don't need to tell you, but this is what my mindset. I want to broad this plastic surgery to the neediest one, poorest one, the last person in the society, because I am from the last person of the society. Okay, my origins from the very poor family, right? And that was my dream, that was my mindset, and today I am very happy, very happy, extremely happy. Why? I could fulfill it. I could fulfill it in last 25 years. So this is what, even the middle of the night, even the 12 o'clock patient comes, I will operate on 12 o'clock. Even the patient comes 2 o'clock in the midnight, I will operate at 2 o'clock in the midnight. With that enthusiasm, with that energy, I really enjoy it, really enjoy it. So these are the patients, you know. You just can't imagine, but yes, we can do it, we can do the best. I mean, there are so many, it is like a horror movie, right? So these are the injuries, you just can't imagine these injuries and how to reconstruct this patient. These are something beyond doubt, but these are the patient, you know, what is more important here, you need to repair the nerve, artery, muscle, skin and everything. This is very difficult because if this patient had been to any general surgeon, I was a general surgeon, I have also treated this kind of patient. It was impossible to treat this patient because even taking just suturing not a cardiologist repair of these cases. Okay, and these are the patient. You know, this patient, if you want to travel from Latur to Mumbai for this repair, is it possible? And now these are the patient getting their treatment in Latur with this quality, right? So this is something really great. This is something really important, and that you must deliver it. The place doesn't matter. Place doesn't matter. What matters is your mentality, your mindset, your technology, your technique and your upgrade. You always upgrade yourself. Don't say I am doing the world standard cases. You compare it, you do it, you show it and then you prove yourself. This is something really great. So, Harry. What is that name?
Just the next part.
अच्छा, okay, fine. Great. त्याला स्टार्ट करायचं आहे त्याच्यावर क्लिक ऑन दिस जस्ट क्लिक इट नथिंग इट विल रन I was telling you the mindset. If you practice, second thing, the mindset about your branch, which to choose. Nowadays, all medical students, they are asking me, sir, I want to do a radio, I want to do dermat. I don't mind it doing it, but I really hate these branches. I really hate these branches from my bottom of the heart. What is there in radio, yaar? सोनोग्राफी करो और डॉक्टर को दिखाओ. ये कौन से डॉक्टर होते हैं? How many of you can really, after diagnosis, can give treatment as a radiologist? Every branch is needed. Every branch is needed. I respect every branch. But why you are behind radiology? I don't know. You know, what I love to do is a surgery. Surgery, एक घाव दो टुकड़े. ये मेडिसिन ले लो, ये मेडिसिन देके हो, ऐसा कुछ करने की जरूरत नहीं है. कट करो, जोड़ो, खत्म बात. बराबर है ना? But you know, everybody should not do a surgery. You know medicine people, you need a radiology people, you know pathology people, you know pharmacology, you know every pediatrician, orthopedician, you know every branch. But why you are just behind only radiology or only dermatology? The reason being, आराम करना है, हाँ, शांति से जीना है, बराबर है ना? This is wrong. This is 100% wrong. जाओ पढ़े. Let me tell you, to me, I was a merit holder. I have got 14 gold medals. Till date, not a single medical student having a 14 gold medal on his name or her name. In 36 years of my life, right? I was a merit at final MBBS, and in our time, the PG was getting only final MBBS marks in the university. होत नाही करावं दिलं काय प्रॉब्लेम नाही इकडे हां त्याच्यावर okay, so having a gold medal in every subject in final MBBS, getting every branch. So I was intended to do orthopedic surgery, ortho. But that time there was only one post in ortho in Government Medical College in Sambhajinagar, and that went to the OBC. I was in open, didn't get it. Then second thing, after doing my MS in general surgery, I was intended to do neurosurgery. The reason being, my brother underwent a renal transplant in 1995, 30 years ago. 22nd February 1995 was the renal transplant day. Okay, and that time when we used to visit neurosurgeon or the nephrologist, they are the biggest people to me while in my general surgery course. So I was intended to do a neurosurgery, and I gave a seat, that time CET exam for super specialty, and I was third in the Maharashtra, getting every branch. Again my brother denied to do neurosurgery because neurosurgery is a costly branch. We are from very poor family to start the practice, so go for the plastic. And that is why I came to the plastic. Means, see, ortho, no more ortho. Neurosurgery, no more neurosurgery. And I am doing plastic surgery, but today I am here proudly telling you the plastic surgery is born for me and I born for plastic surgery. Okay. Coming to these are the, see, this is the kind of patient they come to me. Anything, amputation, anything, they just bring to me, and I just harvest a graft from him, put it down again back, complete amputation. They putting the hand into the carry bag and they just bring to me. And this is every day's picture. This is for every day. This is every day. I do minimum 3 injuries per day. We operate in our hospital. A minimum 3 injuries per day. Can you imagine this? Alright. So this is a huge work. Presently we are doing it at our center. And once you become a popular, very difficult patient. This patient came from Mumbai to me. Right. Now you tell me any medical center in the world, they refer the patient to Latur. Okay. This is a very difficult patient. When we operate on this patient, this blade like anything, we given 10 points of blood on table and could finish this case in 17 hours. Okay, and see the final result. Most challenging cases, most difficult cases, see this. Once you are doing difficult surgeries, the difficult patient will come to you. And once you accept the challenge, you become famous and popular, right? But somehow my mindset is, why not we? Why not me? What is difference in Mumbai and what is difference in Latur? Nothing. Do it. Go ahead. Okay, and have a great team. See, this is how I exercised everything. I put it a graft and she's now here. Alright. So these are the very challenging cases, challenging the world. Nobody can think doing these surgeries in small setup, but we are doing it, we have done it, and we continue to do it. And you know, only the nose surgery supposed to be done by very big people. But in my setup, I do a rhinoplasty, and let me tell you, we do rhinoplasty every day, right? And see, these are the pre and post pictures. These are the pre and post pictures of so many patients. See, these are the patients, they come to me. See, pre and post pictures. Can you imagine, she's the same girl on the left side? No, but yes, she's the same girl on the left side. And they are so happy. My dream was, yes, of course, surgery from elite group, it is accessible and they are coming to me, I am doing it. But my aim was, this surgery should be done by the poorest one. दुसऱ्याच्या घरी भांडे घासणाऱ्या लेडीच्या मुलीने पण ही सर्जरी माझ्याकडनं करून घेतली पाहिजे. दिस वॉज माय एम अँड आय एम डूइंग इट. And these are the few of the cases. I'm just representing you. But let me tell you, 170 rhinoplasty per year is the only center in country, and only the second center in the world. शब्द समजून घ्या मी काय म्हणतो ते. Number of rhinoplasty highest in our country and number 2 in the world. जर्मनीमध्ये 250 सर्जरी वर्षाला होतात, त्याच्यानंतर लातूरमध्ये 170 होतात. देयर इज नो अदर सेंटर. And this is possible in Latur. This is possible in Latur, right? So I'm then I have started with the burn unit. Whatever the need, I always think I should do it. These are the machine. This is the first machine in Maharashtra called as MIG micrograph. हा व्हिडिओ सुरू होतो का रे? हा रन होतो का बघ. याला हे दर्शन दाखवू का सेंटरचं? नो सॉरी, जस्ट हा व्हिडिओ होतो बघ. Yes. See this video. It's a only 1-2 minute video. It's a MIG micrograph. This you will hardly get a chance to see this. This is a machine where, you know, in the burn patient, what is more important to cover the burn area with the skin graft. But the problem is the skin graft to harvest from the burn patient is difficult. The reason being the skin is burned. Where to get the skin graft? So we harvest very small piece of the graft, very small, wherever the possible. Burn patient is burn patient. If there is small graft here available, I harvest from here. If the scalp is open, I harvest from the scalp. I harvest from any part of the body, small graft. I make it into pieces. This is a technique developed in Netherlands. Okay, and I was banned. See, whatever I am doing, I want to do the best in the world. Best means best in the world. Okay, it's not a compromised surgery or compromised technique. So this is a technique. I adopted it. I got the machine. I had went to Netherlands. I had went to Holland for some time, and this technique was helping me out. How to help? This is a technique of expanding the graft. Expanding the skin graft is a technique. See, this is how I excise it, the deep burn, and this is how the machine works. See now how does this machine work? The small island. There is a principle. There is a gap in between the island. Even the 5 mm gap on either side will heal with epithelialization. The technique is a principle, is a physiology, right? So this is how I harvest a small piece of the graft. I expand it and put it back, right? So I need a very small graft and cover the biggest area. Means the 1% of the graft will cover the 10% of the area. Means to cover the 40% of the area, I need only 4% of the graft. See, and 4% means this is called as a percent. One palm, this size is called as a percent of the graft. This 4 you can harvest from any area, and this is how it heals, right? This is how it heals. So even and I pinch it after 10 years or 20 years or something like that, and that really works very nice. only there is small, even these kind of pediatric burns come to me. Even these patient, to harvest and graft is difficult. So I have even dermatome, I have different machine. This is a dermatome in the hand to harvest a graft. This is electric dermatome. I have every equipment available in the world with me, doing all kind of surgeries. This is how I excise it. Again the same principle. I put it into the machine. I just expand the graft and put it back. Right. So same principle I apply. In any burns, most important thing to cover the burn. I have shown you the first picture. Just that was a contracture because that was not covered on very early days. Once you cover it on early days, if it heals primarily, there will be no contracture. So what is more important in the burns, that is what I learned. That is what I learned from my seniors. I learned from my person who are doing it, burns unit across the world, and I have started using this machine, and this is how this bachu has come up. So this is something really important. Adopt the technique. And these are the same patient. Just I want to show you the few of the only thing, the problem starting the center in the small town, you have to be every role, like administrator, like RMO, like receptionist. You are the same. Right? You have to see the generator is on or not, light is there or no, oxygen cylinder is full or empty. Everything you have to see for some days. But I am a person, I always disperse some responsibilities. Even I did it, but I form a good team with my wife and my anesthetist. This is the only team started with. But you know, this was the only team. Over a period, we have started a good team. And let me tell you, this is a team today. Good people working with me. It's a great team. This is my new hospital. I have 3 more hospitals and 4th I am started constructing. 220 hospital I started cutting on 26 January. It will be completed in next 4 years when my son will be completing his MCs and classes and come back. And that will be the biggest hospital in Latur and the territorial area. Starting with, just let me tell you something great about it. This is a unit. 20 years we are doing free of cost. 20 years today. Right, and we have completed this kind of 10,597 surgeries till date. This is one unit rendering rhinoplasty, and we do a highest number of rhinoplasty in our country, and completed more than 3,000 rhinoplasties. Last 25 years, 50,000 total surgeries. Doing a plastic surgery is not a joke. Try to understand, it is not a surgery like a cataract, 2 or 3 minute job. It's 16 hours, 14 hours, 3 hours, 4 hours surgeries. So we have to render it and we have to put it together. So every day working 14 hours per day for 25 years, could able to do this number of surgeries. And you know, you people, or everybody will think, the person from Mumbai, I have no objection on Mumbai people. I have no objection on metro people. Absolutely no. But not the only choice. That is what I want to tell. If somebody want to settle, my brother is settled in Mumbai. My niece, my nephew is settled in Mumbai. I ask them, why not to come to Latur? No, we just cannot survive in Latur. Good enough. I don't have any objection on that. Okay. I never ever say no to them. But there are options outside as well. This is what just I want to tell you. Okay. So, but having only in the institution like this medical college, alright, the professors, all faculty will have the academic activities. Having in Latur, having no air connectivity, how to do academic activity, how to be updated. But let me tell you, I have almost, now this is again an old slide, but I have attended 100 plus conferences and I have 100 plus papers, okay, presented. How many professor and head having these kind of papers? Okay, even today, every month I write one paper. Right? Now today is a very different issue. I have fellows and I have so many people working with me. I just dictate and everybody is getting ready for that. But even from day one, I write a paper. I publish it. I always see advice for the senior people. And these are the activities we organize it from 2007, 2002, right? These are the national activities we organize. These are the team from the Interplast America, There are so many activities. These are all activities in Latur, right? On burns, on rhinoplasty, on cleft. He's Dr. Baman Davar. Just I want to show you the picture of Dr. Baman Davar in Latur in 2008. He inaugurated my hospital. I admire him like anything. These are the meeting, and he, Dr. Ian Jackson. You know Ian Jackson, I wrote him, Dr. Ian Jackson from Michigan, I wrote him minimum 100 email. I want to do some fellowship, sometime fellowship with you, some period, maybe 1 month, 2 months, 3 months. And I got the answer for 3 years, we don't have vacancy. And that Ian Jackson came to me and stay with me. See, this is how it happens. This is what it happened. And he has operated in my hospital. Rather than I going to Michigan, he came to Latur. So this happens. Okay, this is possible. So he is Dr. Ian Jackson, and these are the different activities we conduct. Just I want to tell you the last few minutes of my talk, and this is for you people. What is more important, everybody know about the IQ, intellectual quotient. Lekara hushar आहेत medical ला पाठवा. I do agree. Okay, but at the same time, what is more important is the EQ, emotional quotient. Okay, just maintain it. This is something important. I really enjoy my life with my parent. I really enjoy. How many of you know what your mother likes? Please raise your hand. How many of you know what your mother likes? How many of you have prepared something for your mother and fed her? How many of you? I don't know, but let me tell you. Now I have got enough servant working with me, holding a huge unit. I work more than any medical college, busiest medical college in the Maharashtra. I am putting more than that work in Latur. One department, any department compare, any plastic surgery department in the Maharashtra, our workload is more than any government medical college plastic surgery department, right? And I have a huge team, but I prepare my mother's tea every day. I prepare my mother's tea every day. I just fed her. I asked her, my cha ka zala go? And she answered, खूप छान झाला. You know that खूप छान झाला is energy for a day to me. I really enjoy that life. जेव्हा केव्हा वेळ मिळेल ना, एक 5 मिनिटाच्या मांडीवर जाऊन झोपायला पाहिजे. Nothing like this. You know how much work I do, how much people they work with me, how many hospital I'm holding, doesn't matter. What matters is the affectionate bond in between your mother, father and you. That really matters. And that was my dream, that was my aim. And I'm very lucky my parents were with me till I completed my 55 years of my life. So you know, this is something really you do it. This is my advice. Okay, whatever you earn, whatever big you are, how much your professional credentials, but what is more important credentials is the bond between your parents and you. And just maintain it, yeah. Just maintain it. And that is something really a strength. You know, I enjoyed it. I enjoyed like anything. Enjoy this. This is my advice to you people. And you see, this is how we do it. My father. I miss him like anything today. But you know, we celebrate every festival with them, every festival. Very smallest and very biggest with them. Very memorable pictures I have. See, he's my son. At his 3rd MBBS, when he has a holiday, he is his job. You know, I have shown you one pictures and I just mentioned my son Prasad is a tonic to my mother and father. That is a real story. They will listen to him only. They don't listen to me, my wife. And she is my wife, Kalpana, feeding my mother. See, even I miss her as well. celebrating every small day, caring with them, spending your best time with them, sharing every success with them, that is life. That is life. Okay, my father doesn't know anything about the surgery, but Italia is my father. मला एक ऑपरेशन दाखव रे, show me one surgery, the biggest one. And me is the person. अण्णांना एक ऑपरेशन थिएटर मध्ये घेऊन जाणार, ऑपरेशन दाखवणार. बाबू असं कापतो, असं surgery. This is something really great, you know. That is the real enjoyment of the life, and you do it. You don't need a very big thing to happen. Whenever you get a time, just talk to them. And I have 6 lakhs pictures of my mother, father with me. 6 lakhs. You know, and very special bond of my wife with my father and mother. The bond between Kalpana, my wife, Anna and Maya, I just can't have a word to express it. I don't have enough word to express it, and there is no word in the dictionary to express their bond. I don't know how come it come. Ultimate one. आमच्या घरामध्ये अण्णा जाईपर्यंत भाजी अण्णाने विचारून व्हायची, वडिलांना विचारून व्हायची, मला विचारून नाही. आणि तीच भाजी आम्ही एवढे वर्ष खाल्ली. आता मी खूप मिस करतो. Just what I want to tell you, cherish with your parents is a real life. Even today, I am 56, maybe completing in next 1 month, but I feel like I am 4-year-old when I am with them. And I do the same thing the 4-year child will do it. All kind of things. And enjoy that life. That is a life here. That is life. There is no other life rather than this life. And this is how I do every day. Prepare a tea. तिला मस्त थंड करायचं, पाजवायचा आणि मग चहा काचायला लागेल म्हणायचं. मला खूप भारी वाटेल. I miss a tea like anything today. Last 16 July, we lost her. But the best part, I was 90 and Anna was 94. So having a life of 1994, I was very lucky. मला असं वाटतं की आजही माझ्यासोबत असायला पाहिजे होते. This is a different issue, but God has given them good life. They have seen the complete change the scenario, stereotype of the family. Okay, the family, a very small family, very poor family. Poorest one. Can you imagine? We didn't have even the clothes to wear till I passed my 10th. We have to alter the clothes from somebody and wear it. We didn't have money even to travel from our education place to our own native village to go. Even 8 rupees was a difficult thing for us. That was our family. And now my mother has seen this family. My brother is awarded with the Padma Shri, Dr. Vitthal Lahane, doing a plastic surgery. The whole family is settled like anything. My mother has given kidney to my elder brother. Okay, and that kidney is called as a kalpraksha. We called her a kalpraksha. You know, असं त्या झाडाखाली बसावं आणि त्या झाडाला मागावं आणि त्या झाडांनी द्यावं असं माझ्या माईने अख्ख्या कुटुंबाला दिलं. आणि ह्या लहान कुटुंबाचं जे नाव तुम्ही आज पाहताय ना जगात, देशात, महाराष्ट्रात, दॅट क्रेडिट गोज टू माय मदर. त्याच्या पलीकडे कोणालाच नाही. Now, concluding my talk, my advice, and follow this. Don't drink alcohol. Don't eat tobacco or related any hazardous thing. We are in a very noble profession. Maintain it. तुम्हाला एक सांगू मी लातूरमध्ये गेल्यानंतर मला सांगितलं की तू काहीच कामाचा माणूस नाहीस. My friend came to me and they just told me you are useless person. And why? Because you don't drink alcohol, don't eat non-veg, don't give parties. How to settle a practice? मला इतकं वाईट वाटलं ना. म्हणजे टू सेटलिंग डाऊन द प्रॅक्टिस यू नीड टू ड्रिंक द अल्कोहोल. हू टोल्ड यू? मी म्हणलं माझं नाव विठ्ठल ठेवलंय माझ्या माहिती, मी काही दारू पिणार नाही. कोणाला प्यायचं तर प्या, नका पिऊ. Then the next person came to me and he told me की then you will not get any friends. म्हणलं नाही तर नाही, काय फरक पडतो? See, I had decided to ethical practice. मी पेशंटला एक शब्द खोटं बोलत नाही आणि 1 रुपया कोणा जास्त घेत नाही. 1 रुपया जरी जास्त घेतला तरी पाप लागेल असं मला वाटतं. कष्टाशिवाय मी 1 रुपया खोटा कमवला नाही, मरेपर्यंत कधीच कमवणार नाही. मी कुणाकडनंच खोटे पैसे घेत नाही. मी कुठल्याच कॉन्फरन्ससाठी सुद्धा कुणाचा 1 रुपया घेत नाही. मी कुठल्याच फार्मास्युटिकल कंपनीकडनं 1 रुपया घेत नाही. लॅबवाल्याकडनं पैसे घेत, मी कुणाकडनंच पैसे घेत नाही. माझ्या कष्टाचे पैसे फक्त मी कमवतो आणि मी मरेपर्यंत कष्टानेच पैसे कमवतो. एवढी सरळ साधी स्वच्छ प्रॅक्टिस करून सुद्धा मला काहीच कमी नाही आहे. माझ्याकडे 3 हॉस्पिटल आहेत, एवढे मोठे लोक माझ्याकडे काम करतात. आय डोंट हॅव प्रॉब्लेम. जस्ट आय वॉन्ट टू टेल यू these are the way out. दारू पिणे हा वे आउट आहे, कुणीच नका पिऊ. वी आर इन ग्रेट प्रोफेशन. वी आर व्हेरी डिफरंट पीपल फ्रॉम द अदर पीपल. वी आर द क्रीम ऑफ द सोसायटी. वी आर इन नोबेल प्रोफेशन. मेंटेन द लिगसी. ओके, मेंटेन द नोबेल प्रोफेशन्स, एव्हरी इथिकल पार्ट ऑफ इट. डोंट ड्रिंक इट. लोक दारू पितात तुम्ही प्यावी तर मग तुम्ही पण तेवढेच बरबाद आहात. मला किती कळतं माहीत नाही मला, पण तुम्ही पण बरबाद आहात. नका पिऊ, अजिबात नका. नॉट एकदा पण नका पिऊ. मी एकदा पण दारू नाही पिली, काय झालं रे माझं? आणि तुम्हाला सांगतो की somebody told me की you will not get a friend. आता फ्रेंड ठेवायला जागा नाही की माझ्याकडे, त्याला कुठे ठेवी भानगड झाली. सिरियसली यार, पीपल वी हॅव स्मॉल ग्रुप. दुसऱ्या डॉक्टरची बायको त्याला विचारते तुम्ही लहाने सरच्या ग्रुपमध्ये आहेत का? कारण माझ्या ग्रुपमध्ये जागाच नाहीये. तुम्ही लहाने सरच्या ग्रुपमध्ये नाही आहेत म्हणजे तुम्ही खराब आहेत. आता लोकांच्या बायका त्यांना नवऱ्यांना सांगायला लागल्या त्या ग्रुपमध्ये जाणे तुम्ही खराब आहे. आणि अगोदर लोक मला म्हणाले तुमच्या ग्रुपमध्ये कोणी येणार नाही, तुला फ्रेंड होणार नाही, तू दारू पी. प्लीज डोंट डू इट. प्लीज डोंट डू इट. ओके. आणि तुम्हाला सांगतो की तुम्हाला काय अधिकार आहेत पेशंटला सांगायला दारू पिऊ नका म्हणून? तुम्ही जर पित असाल तर खरंच अधिकार नाही. सो जस्ट मेंटेन द लिगसी ऑफ दिस प्रोफेशन. तुमचा वडील या नात्याने तुम्हाला पुन्हा एकदा सांगतो की खूप छान राहा. माझा मुलगा यार तुमच्यापेक्षा थोडा मोठा आहे. याला असं एक तुम्हाला सांगू का, तो माझ्यापेक्षा 10 पट चांगला आहे. 10 पट चांगला. शब्द समजून घ्या मी काय म्हणतो ते. या लेकरांनी त्याच्या स्वतःच्या मेरिटवर शिकतोय, पण साधी गाडी पण तो कधी माझ्याकडे मागत नाही. मी घेऊन दिली तर वापरत पण नाही. माझ्या वर्गामध्ये 200 मुलं आहेत, सगळेजण पायी येतात, मी पायी जाणार. मला काहीच कमी नाही करून तुम्हाला खरं खरं सांगतो. म्हणजे मला खरंच काही कमी नाही. मी चिमटा घेऊन बघतो, मीच आहे एवढं मला देवाने दिलं. ओके. हां, पण वाय एम टेलिंग ऑल दिस स्टोरी, द रिझन बी की तुमच्या एवढाच मुलगा एवढा सज्जन पण राहू शकतो. दारू विरुद्ध सोडून द्या रे. घरामध्ये अंडी जरी आली तर जमत नाहीत, बाकीचं सोडूनच द्या. माझ्या लेकराला घरात अंडी आलेली जमत नाहीत, त्याच्या परस्पर आणा लागते खायची असते. ओके. आणि एक शब्द त्या आयुष्यामध्ये इकडे तिकडे बोलला नाही. आपलं काम सर्जरी. मला काय म्हणायचं आहे, द क्रेडिट गोज टू माय अण्णा and my wife. The credit goes प्रसादची जी काय आजची डेव्हलपमेंट आहे बिकॉज ऑफ माय अण्णा आणि माय वाईफ. मी नाही वर देऊ शकलो, पण दिस काइंड ऑफ पीपल कॅन हॅपन. तो पण मेडिकल स्टुडंट आहे, कसली सवय नाही. मला काय सांगायचं ना, सवय नका करू. ओके, बिलकुल नका करू. आणि माझं ऐका. किती जण ऐकणार आहेत? किती जण ऐकणार आहेत? तुम्हाला माहिती आहे का माझा विठ्ठल आहे. खोटं प्रॉमिस केलं की पाप लागतं. हाऊ टू सक्सेस इज these are the, you can go on the YouTube and see, there is a key to success is my talk, anybody can see, so I will not elaborate more on this. And this is just I want to tell you, deconstructing the stereotype. This is the work we are putting it. We do 2,500 surgery. Dr. Sahab, how many units in Maharashtra does 2,500 surgery per year in one department in government medical college or private medical college, having minimum 10 faculties, having one faculty and doing 2,500 surgery per year. That to last 25 years. Okay, हे possible होऊ शकतं. Do it. And I would like to take this opportunity to invite you all my younger colleagues to take up this path less trodden. It might be more rewarding than you give the credit for it. Set up your practice in 2-tier or 3-tier cities. Ethical practice is the only thing that matters in long term. All the best. Thank you so much.